Hello, everyone. My name is Hannah Frisella, and my presentation is about von Willebrand's disease. Before getting into more information about von Willebrand's disease, I want to talk about blood and how the mechanism of coagulation occurs. I feel that it would be best to explain how vital blood is and this mechanism before getting into the disease itself. Blood is an essential component for life and is produced through a process called hematopoiesis to deliver the oxygen and nutrients to tissues and cells throughout the human body. When there is an opening wound, such as a laceration, we lose blood. And so that we don't lose a significant amount of blood, our body undergoes a clotting process. The factors that work together in order to control blood loss are vascular mechanisms, platelets, coagulation factors, prostaglandins, enzymes, and proteins. So this clotting mechanism is divided into two processes. We have our primary hemostasis and our secondary hemostasis. With primary hemostasis, there are 4 phases that are required to form a platelet plug. The first phase is vasoconstriction. So vasoconstriction causes the blood vessels that is involved in injury to compress and reduce the amount of blood flow. The second phase is platelet adhesion. And in this phase, the platelets are attaching to the site of injury. And platelets contain a G protein receptor, which binds to a glycoprotein called von Willebrand factor. And with this binding, it allows platelets to build up at the site of injury. The third phase is platelet activation, which changes the shape of the platelets to a pseudopleural plug. And it increases the surface area and prepares for the last phase, which is platelet aggregation. And then once the platelets are activated, the G protein receptors are bonded to the proteins and von Willebrand's factor and fibrinogen. And for the secondary hemostasis, stabilization for the weak plug is achieved and then forms a clot to the fibrin network. And in order for this to work, the activation of clotting factors must occur to then convert to fibrinogen to fibrin and then prothrombin to thrombin. So the thrombosis is, achieved. And so after this mechanism, the blood has successfully clotted and the blood loss is over, And then, however, with von Willebrand's disease, it can alter the process when blood is needed to clot. So von Willebrand's disease, it's also abbreviated as VWD. It is a commonly inherited bleeding disorder. The cause of this bleeding disorder is due to possible defects or deficiencies in the von Willebrand factor clotting proteins, platelets, or receptor interference during primary hemostasis. Another cause for von Willebrand's disease is mutations in the von Willebrand's factor gene, which instructs the process of coagulation. With the defects or deficiencies in these contributors, blood coagulation would not work effectively. And so von Willebrand's disease, it is known that it affects 1 in 100 to 10,000 individuals. And so there are different classifications of von Willebrand's disease. We have type 1, type 2, and type 3. And so type 1 von Willebrand's disease is considered as the most common and mild form condition where 75% of individuals are affected. With type 2 von Willebrand's disease, there are 4 subtypes that are moderate to severe respectively. So we have type 2A, type 2B, and type 2M, and type 2N. And then lastly, the rarest form, but it is considered as the most severe, is type 3. With von Willebrand's disease, people can experience signs and symptoms. These signs and symptoms include easy bruising, long-lasting epistaxis, excessive bleeding after injury, surgery, or oral bleeding, especially during or after surgical procedures. Women with von Willebrand's disease may experience heavy or prolonged hemorrhagia during menstrual cycles, but during pregnancy and childbirth, women can also experience excessive bleeding in the reproductive tract. With menorrhagia being the most common symptom of von Willebrand's disease for women, this disorder can also cause excessive bleeding during pregnancy or after childbirth. With mild signs and symptoms, von Willebrand's disease can be underdiagnosed because people are unaware of this condition. However, in severe cases such as type 3 conditions, it is common for joint bleeding to occur, resulting in difficulty with moving and is painful. People with von Willebrand's disease should be aware of risk factors. Being this is commonly an autosomal dominant inherited disorder, the mutated von Willebrand factor gene can only comes from one parent and is passed on to their offspring if it is autosomal dominant. If someone had von Willebrand's disease and their significant other does not, there is a 50% chance that their offspring will inherit this disorder. However, there is a higher risk for offspring if both parents have von Willebrand's disease. And if both parents show mutations in the von Willebrand factor gene, the disorder is considered now as autosomal recessive. And there is a possibility of this disease being passed down in a more moderate to severe form. With severe forms such as type 3 von Willebrand's disease, uncontrollable bleeding can occur, and it could be life-threatening. So in this chart here, we have somebody that is not affected with the mutated von Willebrand factor gene, and then we do have a person that does carry the mutated von Willebrand factor gene. And so whenever, they can give 50%, a mild form of von Willebrand's disease. However, just say that this is not their offspring, but say right here, this is two people and this is their offspring, and you see that two of them have the mild form of von Willebrand's disease. Well, it is that that their offspring can carry a 50% chance of it, or this offspring can carry a gene from both mother and father and can have an autosomal recessive disorder, even though that their parents are autosomal dominant. So it can form if they carry both genes. Oh, I'm sorry. I also want to say that if one or both parents have von Willebrand's disease, it is also important for them to monitor their children for signs and symptoms to further on seek healthcare, depending on how severe their conditions are. So when diagnosing von Willebrand's disease, there is no single diagnostic testing that provides results. To diagnose von Willebrand's disease, multiple screenings are required to confirm the presence and functions of von Willebrand's antigen, or the von Willebrand's factor restosetin cofactor activity, the factor VIII protein binding and activity, the von Willebrand factor gene sequencing, the von Willebrand factor propeptide levels, and the von Willebrand factor platelet and collagen binding. With these diagnostic tests, which is pretty much all blood screenings, with all of this, they each result in a deficiency or low range and will indicate if a patient has von Willebrand's disease. So the more decreased or more amount of abnormal results, the more severe the condition can be. And there are different types and subtypes of von Willebrand's disease due to the results confirmed from these screenings. When screening the von Willebrand factor gene and protein, it is important to take into consideration also the patient's blood type, ethnicity, and modifier genes that were implicated. So if patients show no signs or symptoms of von Willebrand's disease, treatment plans are not really given unless needed. However, it is important for all patients that are diagnosed with von Willebrand's disease to notify physicians before undergoing any surgical procedures, no matter how minor or severe the condition can be. Mostly patients are given a nasal spray before surgery, and that allows the blood to clot more effectively. With more severe forms of von Willebrand's disease, surgeons will have to take precautionary measures or not even operate, depending on how severe the condition is, because it is life-threatening. With patients with moderate to severe cases of von Willebrand's disease, they're usually provided with a prophylaxis to prevent continual bleeding at the joints. And for women that are women, I'm sorry, for women, there are various treatments to control bleeding during their menstruation cycles as well. There's different various treatment modalities in order to keep it under control. Even though prevention of von Willebrand's disease is unfortunate, self-care can be done to minimize signs and symptoms of von Willebrand's disease. First, all patients with von Willebrand's disease should avoid injuries if possible. For example, if you are having to cut vegetables for a soup or whatever it may be, it is important that you take your time and you're careful. Second, patients should not take aspirin, and if so, should stop immediately because aspirin, as you know, decreases the blood's ability to clot. And it is commonly used for patients who may have had, say, like a cerebrovascular accident or stroke. And since we already had a deficiency in our clotting mechanism, we don't need to decrease our ability to clot any more than what it is. And then third, if patients with von Willebrand's disease are anemic, it is important to continue blood transfusions and should take folic acid supplements if suggested. And then another thing, if you are anemic and say that it's a iron deficiency anemia, you can have a proper dietary intake. And so if you increase your meats, your red meats, say leafy greens, so how you know the greener the leaf, the better it is. So your kales and spinach, and then seafood, beans, nuts, and seeds, that all can help with iron if needed. And so to help patients with their disease, if patients have questions or concern, it is important for them to follow up with their doctor. It is considered as a commonly inherited disorder, but so many people are unaware of this medical condition even existing. So how can we help them? So as a healthcare provider, it is important to understand the patient's conditions to provide effective care for them. And then most of all, it is also important to provide that patient education because you are explaining how they can improve with their disease, and overall it can improve their quality of life. And that's the most important thing. And this was my presentation on von Willebrand's disease, and I really hope this was interesting to you guys, and I can't wait to see what everyone else's presentations are about. Have a good day.